This episode is brought to you by Nordstrom. Whether you're packing for a vacation or dressing for a wedding, Nordstrom has head-to-toe looks for wherever summer takes you. From swimwear and bold color to romantic florals and dresses that make an entrance, find the right style for every unforgettable moment. Shop new arrivals from brands you love like Farm Rio, Free People, Vince, Wait, and Stod. Plus free shipping and returns and styling help whenever you need it make it all so easy. Shop now in stores at Nordstrom.com or download the Nordstrom app.
Girl, winter is so last season. And now spring's got you looking at pictures of tank tops with hungry eyes. Your algorithm is feeding you cutoffs. You're thirsty for the sun on your shoulders. That perfect hang on the patio sundress. Those sandals you can wear all day and all night. And you've had enough of shopping from your couch. Done hoping it looks anything like the picture when you tear open that envelope? It's time for a little in-person spring treat. It's time for a trip to Ross. Work your magic.
Hey y'all, it's Kelly Clarkson here to talk Wayfair. No matter your space, style, or budget, shop Wayfair.com to make your home way more you.
Wayfair, every style, every home.
The following program does not offer personal medical advice. Please consult your doctor before using any treatment or product we cover. Welcome to Go to Health Media with your host, Jonathan Marks. We provide a welcoming environment where experts educate you on important health topics, answer your questions, and provide information from which you can benefit in consultation with your doctor. You can visit and subscribe to the show at gotohealthmedia.com. And now, here is Jonathan Marks. Hey everybody, this is Jonathan Marks from Go to Health. Welcome back to another show. Today we're talking about a great topic. While the topic of mental health has become less taboo in recent years, many still struggle to talk about it or seek out help. Data from the National Institute of Mental Health revealed that less than half of adults with mental illnesses, only 47%, received mental health services as late as 2021. Words matter, and one of the best ways to reduce the stigma around mental health is to talk about it openly with inclusive language and encourage others to do the same. Our guest today is Dr. James Polo, Chief Medical Officer at Carillon Behavioral Health in Boston, Massachusetts. Dr. Polo is responsible for leading the development of CBH's medical policies, protocols, criteria, guidelines, and specializes in organizational healthcare consulting and hospital and behavioral health system leadership. He's got more than 30 years of healthcare experience, and he's also has proudly served in the United States Army. His company, Carillon Behavioral Health, offers clinical mental health and substance use disorder management, a comprehensive employee assistance program, work-life support, specialty programs for autism and depression, and insightful analytics to improve the delivery of care for federal, state, and local governments, health plans, and employers. It has been delivering high-quality behavioral health care for more than 40 years across all 50 states. And for more information, you can visit carillonbehavioralhealth.com. So welcome to the show, Doctor. How are you today?
I'm doing well. How are you today?
Wonderful. Good. So I have some questions for you. We have just a brief time here. Why should mental health be considered just as important as physical health?
Yeah. So, first of all, the mind and the body can't be separated. If you're going to struggle physically, you're probably going to have an impact to your emotional well-being. And if you're struggling emotionally, it's going to impact your physical health. A very simple example, if you're struggling with depression, you're twice as likely to develop diabetes. So if you really want to stay healthy, if you really want to focus on well-being, you've got to make sure that you're physically healthy, but you also want to make sure that you're emotionally healthy.
Good. And can you repeat what you just said about diabetes? That's an important fact there.
So there's a ton of statistics out there, and I know people can sometimes feel overwhelmed with that. So the one that I like to just highlight, if you're suffering from depression, you're actually twice as likely to develop diabetes.
Wow.
Most people know what diabetes is. They don't want to get that. It requires taking medication. It's an impact to your health. But if you're struggling emotionally, that's going to impact your physical health. So you want to make sure that you're addressing your mental health at all times.
I'm so glad you brought this up. Thank you for mentioning that. Why do you think there's such a stigma around mental health issues, and how can we overcome that?
Stigma's been around for a long, long, long time. And I think at the core, when it comes to our mind, when it comes to our emotional health, first of all, we don't want to share what's going on because we're afraid that other people are going to think we're defective or there's something wrong with us, or maybe we have shame. We don't think we should be having a problem. We should be able to handle it all on our own, and therefore people don't want to share. What's interesting is that if you really think about it and you share what's going on, you're going to find out that you're not alone. So many other people are either struggling or have struggled in the past. And if you can just get it out there and begin to talk about whatever is going on, you're on your way to recovery because you're going to be able to be more, receptive to getting help from other people.
Hmm. So actually reaching out for help is kind of a strength, isn't it? It's not a weakness.
It's a strength. It is not a weakness. It's interesting. We teach little kids all the time. Ask for help if you need help, okay? Because we expect them to need help. As adults, we seem to think we should be able to do everything on our own. So, when it comes to emotional well-being, we struggle when there are things that we either haven't foreseen, we're not used to, and more often than not, simply talking with other people will be helpful. Now, if you're having a very serious, challenge, then talking to a professional that can really help guide you is really what's going to be important to help you get through it. But you've got to be able to take that first step.
Great. So you mentioned talking to a professional. What are some tips for finding mental health support? What should you be looking for?
Yeah. Well, first of all, it's always important to remember if you have an emergency, you're at a point of crisis, then call 988. Just like we call 911 for a medical emergency, you can call 988 for a mental health emergency. But if you're looking for help for something that's been bothering you or something that's building, I generally recommend starting first with your regular doctor. Your regular doctor is going to know you. This is a question they get all the time. They're going to be able to help guide you. There's all kinds of different counselors, therapists, psychiatrists out there, and it can be tough figuring out which is the right level that I need to be seen at. But once you're connected to an individual, the most important thing is this someone I can talk to? Is this somebody I can feel comfortable sharing some of those inner thoughts and inner feelings that maybe are a little bit sensitive? And if you're able to develop a sense of trust, then you're going to be able to share more, and that individual is going to be able to better help and guide you back to well-being. So it's really important to have a trusting relationship.
Good. And tell me a little bit more, this stigma around mental health. We have no problem, as you said before, saying, oh, I've got a cold, or I've got pneumonia, or I've got this, or I was sick with that, and it's okay, and you get over it. What's the difference with physical health issues and mental health issues in people's minds? Do we understand?
I think the biggest issue is for a long time, we haven't talked about mental health. It's very mysterious to many people. The system is difficult to navigate. And there's different kinds of stigma. There's stigma that you have on yourself. Hey, I should be strong. I should not be ashamed. I should be able to do that. Self-stigma. But there's also stigma from other people. There are many folks that actually do think that folks that are having mental health problems are somehow defective. And unfortunately, those people kind of make it hard for the folks that are struggling to sometimes come out of the woodwork and into the open and be able to discuss their problems with somebody. But more often than not, if you can take that first step, you're going to find out that there's many people that are going to be receptive to listening and helping guide you. But you've got to be able to share with somebody else the fact that you're having a problem, that you're trying to.
This podcast is sponsored by Talkspace. When you're really stressed or not feeling so great about your life or about yourself, talking to someone who understands can really help. But who is that person? How do you find them? Where do you even start? Talkspace. Talkspace makes it easy to get the support you need. With Talkspace, you can go online, answer a few questions about your preferences, and be matched with a therapist. And because you'll meet your therapist online, you don't have to take time off work or arrange childcare. You'll meet on your schedule, wherever you feel most at ease. If you're depressed, stressed, struggling with a relationship, or if you want some counseling for you and your partner, or just need a little extra one-on-one support, Talkspace is here for you. Plus, Talkspace works with most major insurers, and most insured members have a $0 copay. No insurance? No problem. Now get $80 off of your first month with promo code SPACE80 when you go to Talkspace.com. Match with a licensed therapist today at Talkspace.com. Save $80 with code SPACE80 at Talkspace.com.
Figure out how to get around it.
And tell me a little bit about family support. Where does family support come in terms of this process? Do people who need help, do they talk about this with their family first? Do they tend to hide it? Is sharing it with your family one of the first steps you should take before the doctor? Tell me about that.
Yeah, so this is a great question. When somebody in a family is struggling, more often than not, the other family members know it. I mean, they know that, somebody's not really being themselves, or they're more irritable, or they're more frustrated, or they're disconnected. So it's hard to actually hide an emotional problem within the family. And unfortunately, sometimes it's relationships within the family that may be contributing to that. So one of the first things is to be able to kind of discuss it with other people in the family. And there are going to be members within the family that will be supportive. And sometimes there are going to be some family members in the family that are kind of part of the problem. And that can be why it's so important to get outside help, to not only help the individual that's struggling, but help the whole family. The other reason why this is so important is because, remember, kids struggle too. So sometimes parents need to be open to the idea, hey, my child is struggling. I need to figure out how to help them. Where do I go get professional help? What's just normal, childhood development versus what are the things I should be concerned about? So asking the questions and being able to kind of figure out, do I have something I need to ask questions about is going to be what's important to get help.
And I know in terms of mental issues, it can be true, can't it? And please confirm this or to tell me the truth about this, that adults sometimes discover their own issues when they realize their children have issues, if these are hereditary.
Well, there's no question when you're raising a child, you think about your own childhood. And sometimes when you're raising a child, you begin to think about things from the past. And sometimes you do have some struggles with that. I wouldn't say that, if a child is struggling, that's going to make you struggle. What I would say is that parents are very sensitive to their kids and they want their kids to do well. And it's hard to have a child that is struggling. And so parents will be impacted by that and want to get them help. Now, statistics do show that if a parent has a mental health problem, major depression, bipolar disorder, any of these disorders that people talk about in the media, then their children are a little bit more likely to have that from a genetic perspective. So it is important, if you're an adult and you have a mental health problem, to be kind of on the lookout.
Yeah, for these symptoms in your child.
Yes.
Got it.
Well, symptoms of anything that would make you think they're struggling. Kids go through all different kinds of periods of development. Throwing a temperature tantrum is not abnormal. That's pretty normal part of development.
Yes.
Throwing 10 temperature tantrums in 10 minutes, now that's maybe a little bit much. So it's a balance, trying to figure out what's normal versus what's not.
Good. So today, May 16th, is Mental Health Action Day. What's the biggest message you'd like people to walk away with from this interview?
Well, the biggest message I would like people to remember is that, first of all, struggling with a mental health issue, it's not a defect. It's just a part of life. If you're having a problem, reach out, talk with somebody, go looking for help. But also, if you know of somebody, a friend, a family member, a coworker, they seem like they're struggling, ask them what's going on. Show some compassion. Be empathetic. Be willing to listen. You may be the person that helps them open up and share what's going on in their lives.
Wonderful. These are great messages. Thank you so much for being with us today. This is Dr. James Polo. He's the Chief Medical Officer at Carillon Behavioral Health, and you can visit Carillon Behavioral Health at carillonbehavioralhealth.com, and that's Carillon, Carelon, carillonbehavioralhealth.com. Dr. James Polo, thanks so much for being with us today. And thank you for educating us about the importance of getting over the stigma of mental health issues.
Thank you. I just appreciate the opportunity.
Thanks so much. Thank you for tuning in this week to Go to Health Media. Be sure to join Jonathan Marks and another health expert next time. You can also catch the program on your favorite podcast platform. Until our next show, be sure to visit us on the web at gotohealthmedia.com and elevate your life.
Your time and expertise are valuable, making Focus one of the most important resources to have at work. These days, professionals spend nearly half the work week on written communication, and it can be difficult to stay on task with all the emails and documents you have to get through. With Grammarly as your AI writing partner, you can stay focused and quickly get through your work with relevant real-time suggestions wherever you write. It works across 500,000 apps and websites, so it can help with everything, from brainstorming presentation ideas to sounding more confident and persuasive in emails and reports. For 15 years, Grammarly has offered best-in-class communication support and enterprise-grade security on a business model that doesn't sell your data. 93% of professionals report that Grammarly helps them get more work done. Download Grammarly for free at grammarly.com/podcast. That's GRAMMARLY.com/podcast.
When you're operating at an enterprise level, nothing drives success more than effective team communication. Grammarly for Enterprise enables your company to work smarter and faster. Other AI tools can't quantify impact. With Grammarly, you get measurable results and actionable insights, like tracking key metrics that include brand compliance and readability from their effective communication score. Because when you're able to visualize your team's impact and compare performance against industry benchmarks, you can make data-driven decisions that improve critical business outcomes. So whether you need to streamline messaging between technical and marketing initiatives or cut down on emails between external collaborators, you can trust Grammarly to help employees communicate effectively across the board. Start boosting productivity company-wide with Grammarly. Visit Grammarly.com/enterprise to learn more. That's Grammarly.com/enterprise.